everyone, my name is Dr. Robin Lewis. I'm a naturopathic physician practicing here in BC, British Columbia, Canada, and welcome to my channel. Today we're going to kick it off with the foundations of cardiology, or cardiovascular disease, heart disease, whatever you want to call it. We're going to first start out by talking about what is cardiovascular disease. Very briefly, I promise you it will not be long. Then we're going to talk about the risk factors that contribute to heart disease or cardiovascular disease. So we're going to take the basics and then we're going to expand on it because I'm coming at it from a holistic lens. That's by nature of my training. And so we're going to talk about everything that contributes, not just the classic risk factors. And the reason for that is so that you can better understand your body. So we're not going to go over mechanisms or anything incredibly detailed, but I do want to give you an idea as to things you can be thinking about when it comes to your heart so that you can be preventative and have educated discussions with your doctor. All right, so let's start out by talking about what is your cardiovascular system. Simply put, it is your heart and your blood vessels. So this is important for delivering oxygen and nutrients to every single inch of your body. Without your cardiovascular system, nothing can get anywhere. So yes, we're generally talking about oxygen and nutrients, but your blood is responsible for transporting anything from one distance to another. So it can also circulate things like toxins, blood sugars, fats, you name it, the blood can deliver it. And this is why it is so central to our overall health. Because if you think about it, there is no single organ or tissue inside your body that does not need good circulation to have everything provided to it and to eliminate the waste that is a byproduct of metabolism and things like that. So yes, we talk about it as a system, and yes, in conventional medicine, it is treated as if it is its own entity, but really it is important for every single aspect of yourself to work well. So that is why we are going to be talking about it in a very broad context. And just know the relationship goes both ways. So yes, your cardiovascular system is important for the rest of the body to work well, but the rest of your body is also influencing your cardiovascular system. So that's what we're going to be talking about today. First up, we are going to be talking about the more traditional risk factors. So these are the things that you're going to find on every single platform talking about risk factors for heart disease. Next, we're going to talk about the more functional wide-angle view of things, but let's go over the basics first. So generally speaking, there is about 10 risk factors that almost every single doctor out there will accept as a risk factor for things like heart attack and stroke. First up, we're talking about hypertension, aka high blood pressure. I don't think there's anyone out there that is unaware of the fact that high blood pressure is a risk factor for things like heart attack and stroke. And it's often one of the number one reasons someone will get put on a heart medication to lower that blood pressure. Second up is cholesterol, and that is going to be the next video that we talk about. So we're going to talk all things cholesterol, or at least the very basics of it. And so cholesterol, elevated cholesterol, is another very commonly accepted risk factor for heart disease. Third is diabetes. So elevated blood sugars are very hard on your blood vessels and on your heart. So that one is very well known and another thing you can kind of look at when you're trying to prevent things like heart attack and stroke or help someone recover from these things. Next up is obesity. So this is a very hard topic to talk about because it's very poorly managed in our conventional medical system. And there can be lots of stigma attached with it. But generally speaking, if you have more adipose tissue or fat tissue, specifically visceral fat, aka abdominal fat, that can be a big risk factor. So of course we all come in beautiful shapes and sizes, but if you know there's weight to be lost, that can be beneficial for heart attack and stroke prevention. Fifth is cigarette smokes. So we all know it's bad for you. The toxins that go into cigarettes are very damaging to the blood vessels, similar to high blood sugars. Very bad for the lungs, which are intimately connected with your cardiovascular system, and that's how your blood picks up oxygen. So cigarette smoke is very, very bad for your cardiovascular system. Of course, there's other things people smoke, and we don't have really obvious concrete evidence on those. So when we're referring to smoking, we're generally talking about cigarette smoke, although I'm sure it takes very little common sense to kind of put the link between some of these other things that people smoke and the fact that it's not so great for you. The sixth thing is age. Sorry to say it, but the older you become in age, the higher your risk becomes. It is very much a disease of the elderly, although you are seeing people who are younger and younger and younger getting things like heart attack and stroke. So I would urge you all to get on this very early, and I'm talking about like in your 30s, like not talking about 40s or 50s, because for a lot of people that's a little bit too late, especially if you have some of these genetic risk factors. But generally speaking, we're more concerned about heart disease the older someone gets. Now this next one is very interesting, and it's very recently been accepted as a very common, strong predictor of heart disease, and that is sleep apnea. So for those of you that don't know what sleep apnea is, it is a sleeping disorder where usually people find out through their partner that they have this because they will snore pretty loudly, and often they will wake up kind of gasping for air, or their partner will tell them, you know, it sounds like you were choking in your sleep. What's basically happening is you're becoming oxygen deprived during your sleep. So as you can imagine, we kind of need oxygen. It's kind of important for your body to function well. And so if you every night are losing oxygen in your sleep, that's going to have massive consequences in the long run. So if you're a snorer, if someone's told you it sounds like you're gasping for air, or if you get your adequate sleep but you never feel rested, there's a potential that you have sleep apnea. Go get it identified. There's lots of great treatments for it, and it's something that you should really get on top of sooner rather than later. All right, we're almost done, guys. Atrial fibrillation is the next one. What did I just say? What does that mean? That is a heart rhythm disorder, and it's the #1 most common of the heart rhythm disorders. Usually people won't be aware that they have this unless they've been worked up by a doctor, because it's usually requiring some sort of imaging to identify. But these are also people who might feel like your heart skips a beat a lot, you're getting weird heart palpitations, like you shouldn't really be feeling your heart beating in your chest. Of course, yeah, during intense exercise, that's completely common, but if you're just sitting at home at rest, go get that looked at. It's not that uncommon of a condition, and it's putting you at a high risk of forming things like clots. So that one's a no-brainer. If you have atrial fibrillation, you want to do things to prevent things like strokes and heart attack. 9th up is something called preeclampsia. So this would be a woman-specific risk factor, and this actually isn't talked about that much. I have found some good resources like the Heart Attack and Stroke Foundation. They'll talk about this, but you can kind of think of it like hypertension of pregnancy. So if you've had a child and you had preeclampsia, you would have been told about it through your doctor. It's basically a blood flow issue to the placenta. So if you had preeclampsia during one of your pregnancies, you would be at a higher risk than someone who didn't. So again, just little clues so that you can get a little bit more proactive about your health. And last but not least, we always have people just throwing it in at the end, exercise and diet. My issue is that's all they'll say. That's all the doctors will say. That's all the online platforms will say, is just exercise more and eat better. Well, if you've ever gone on the internet, you know there's a million different ways to exercise. Everyone has a different opinion about what's the best exercise. Diets, gosh, who knows? Should I be low fat? Should I be high fat? Should I be vegan? Should I eat meat? Should I be carnivore? Like there's a gazillion diets out there. So just telling someone to eat well and exercise is pretty unhelpful. And so part of the goal of this YouTube channel is to elaborate on these things for you guys so you can understand this better. But they do kind of tend to throw that one in at the end. So they're acknowledging the fact that these two things play a role, but they definitely do not handle it very well in a conventional setting. All right, so now that we've gotten that out of the way, let's talk about more functional cardiology. This is the stuff I'm really excited about because these are the areas that people are often going misled. No one's talking about this, but the point is we're talking about how the other systems inside of your body are playing with the cardiovascular system. So your hormones, your nervous system, your liver, like literally all of your body is interacting with each other. So I'm going to talk about some of the more common ones that have really good, obvious links in the literature, so very supported by evidence-based medicine. In my opinion, one of the reasons cardiovascular disease is still the #1 killer globally is because we've oversimplified it. We're not taking more of that functional view. So, if someone has high cholesterol and high blood pressure, you get put on a bunch of medication to lower those things, and then you're just sent on your merry way as if nothing is wrong. When in actuality, your stomach's a mess. Maybe your hormones are all over the place. Your nervous system is absolutely shot and burnt out. All of these things matter, and these are the things that are not being talked about when it comes to things like heart attack and stroke prevention. So that's what I'm going to do here, and that's kind of the point of this channel. All right, first up, we're going to be talking about the nervous system. So the most obvious example I can think of how the nervous system plays with your cardiovascular system is how stress raises our blood pressure. So we all know if you're really stressed out and really revved up, your blood pressure and your heart rate will go up. So think about that happening every single day. Of course, the nervous system and its play with the heart and the blood vessels is far broader than that, but that's a really easy example of how your nervous system and your cardiovascular system are interacting with each other. Number 2, your endocrine system. So this is talking about hormones. So this can be female hormones like estrogen, progesterone, male hormones like testosterone, thyroid hormones. Like the endocrine system is a very big system. One of the best examples I can think of is estrogen. So estrogen is very important for the elasticity of your blood vessels. Having adequate estrogen levels can actually prevent heart attacks and stroke by 40 to 50%. So this is just one example of how one out of your very many hormones can have a heavy influence on your cardiovascular system. So these two are very connected. Third up, we have the immune system. So we're going to talk about this in the next episode where I really dive into cholesterol and the plaque inside of your arteries. But your immune system is part of a necessary equation for even forming plaque. An interesting example of how your immune system and your cardiovascular system are interacting with each other is the chronic infection patients. So I see you, my Lyme, mold, chronic Epstein-Barr virus people. What happens when you have chronic infections, which side note is actually common, is it activates your blood vessel lining. It's also called your endothelium. So the lining inside of your blood vessels that are responsible for forming plaque, that whole process can get accelerated by chronic infections. So identifying these infections is incredibly important. Trying to get rid of these infections equally as important. And it actually plays a very big role for some people's rapid development of plaque inside of their arteries. It can also get into the heart wall itself and the valves and things like that. So chronic infections and your heart and your cardiovascular system, very much linked. On a similar but not quite the same note is your gut microbiome. So this is an area that's getting more and more popularized. They're studying it a ton, they're learning lots about it. But basically we're talking about the different bacteria, viruses, parasites, and yeast that live inside of your digestive tract. So there's actually more of them than there are cells in your body. So there's 10 times more bugs than cells inside of your body. They play a huge role in many different aspects of our health. And they've actually found that certain strains, aka like different types of bugs, have been linked to things like hypertension, increased diabetes risk, obesity, things like that. So these bugs, and having a lot of the good ones and as little as possible of the bad ones, is really going to play a huge role for your overall health. Certainly your cardiovascular system is a part of that as well. And there's actually really good research to show that certain strains can play a massive role when it comes to heart disease. Next up, we're talking about kidney function. So kidneys are important for fluid regulation in your body, And they're also important for the regulation of things like electrolytes and removal of toxins and waste. So your kidneys and your heart play a lot together. If we're thinking about a direct example, the electrolytes in your blood, things like potassium, calcium, magnesium, they actually have a huge role in how your heart contracts. So making sure your electrolytes are well regulated is very important, and that's kind of the role of your kidneys. It's not the only thing, but your kidneys are kind of a major player. So if you have kidney disease or kidney damage, that's definitely going to contribute to things like heart attacks and strokes. Sixth up is something that you would expect a naturopath to be talking about, and that is nutrition. So of course our nutritional status plays a role. So are we getting enough of our B vitamins? Are we getting enough of our omegas? Are we getting enough of those beautiful electrolytes I just mentioned? Your nutritional status can play a huge role, and the science is getting really, really good at finding ways to measure that. So previously, you could kind of look at someone's diet and make some guesses, but now there's really good blood studies, urine studies, stool studies that can really help us assess what the true nutritional status of someone is. So are you truly omega-3 deficient or not? Are you truly magnesium deficient or not? And correcting those things are paramount for your overall health and, of course, cardiovascular disease. Seventh is the health of your mouth. So this is a really interesting one. It's called periodontal disease, so disease of the gums and the bone that are part of your mouth. This is where we see a lot of bacteria and viruses and things like that can get into our circulation. So kind of like the chronic infection thing, but we're looking at it specifically in relation to your mouth, your dental hygiene. And this is something that has really good research behind it. So go see your dentist. That's all I'll say. And I saved the best for last, and that is mental health. So kind of before when I was talking about stress, for sure stress plays a huge role, but things like depression, anxiety, trauma, those all sit inside of your body. And they've even found that depression, for example, will play a role on how likely you are to die from heart attack and stroke. So we all know that not everyone who has these events will actually pass away from them, but depression is a huge risk factor for actually passing away from those things. Or to take that one step further, after you've had those things, like a heart attack and a stroke, and if you become depressed or were already depressed, that's actually going to affect how disabled you become from it and how poorly you recover. So take care of your mental health. This is not something to be ignored or suppressed. It is incredibly important, and it will affect your heart health as well. So that was a lot I just threw at you. You got a ton of information there. You're not meant to retain it all, but it's meant to just plant the seed for people who are curious about their heart health and kind of the different aspects of your health that you can start to work on with your doctor. Of course, by no stretch is this channel meant to replace a doctor visit, but it's really meant to gear you up so you can have an intelligent conversation with your doctor. So if they're not looking at these other aspects of your health, if they're really not taking more of a functional, wide angle, whole body approach to your health, find someone who does, because prevention is so key. And in fact, cardiovascular disease as a whole is 80% preventable. So there's a huge disconnect here. It's the #1 killer globally, but it's 80% preventable. So I say this all to remind you that there's hope. This does not have to be your destiny. Just because your father, your mother, your grandfather, whoever in your family has suffered the consequences of heart disease, that does not mean it needs to be you. So get out there, get healthy, get proactive about your health. There is always something that you could be doing to optimize everything. Thank you so much for listening. I look forward to seeing you at other episodes, and drop any comments or critiques below.